It's time for Morning Rounds this morning.
And joining us this morning is Katy Scheiding to tell us more about National Women's Health Week. Katy, many women have been putting off their doctor's appointments because of the pandemic. Why is it so important now to get checked?
So it's important that they make an appointment with their healthcare provider to see what health screenings they may have missed during the pandemic. Some of them are very time sensitive, and so we want to make sure that we're not missing anything that could be crucial to their overall health outcomes.
Of course, Katy, and now a lot of those, because so many people are doing the same thing right now, it may be hard to get in right away. Is there something that we can do to make sure that we nip whatever we have to worry about in the bud?
So we honestly don't have that to be an issue right now. They shouldn't have any trouble getting in. We still want to implement wearing masks and social distancing precautions, making sure that they're getting their COVID vaccines when that's available to them, which should be open now. So it's important in regards to making sure, like, their cervical cancer screenings, mammograms, bone densities, stress tests, cholesterol screening. There's so many screenings out there that we need to make sure that there isn't a delay in getting those done that, again, may have been missed during the pandemic.
You know, physical health, that's certainly an important portion of it, but what about our mental health right now, too?
So this last year has definitely presented its challenges to many people, financially, being out of the workforce, or stressors with children at home. So if somebody is struggling with either anxiety, depression, or just an abundance of stress, we would recommend that they discuss that with their healthcare provider to see what resources are available to them.
And eating healthy has gotten off track for a lot of us during this time. So how can we try to get back on track with that?
Yeah, it's important to discuss their health goals with their providers, so where they're at currently and what steps that they can take, making sure that they're eating well-balanced meals and getting into a health management or maintenance program, routine exercise. The weather is going to be getting nicer, so making sure that they are using those opportunities to get in some added exercise. It's good for mental health as well to be physically active. Our bodies like to move.
Katy, right now, if people have questions, where can they reach out if they want to reach out to you?
So our local department here at Christie Clinic OBGYN is 217-366-1255, or if they're looking for a department within the overall clinic, it would be 217-366-1200.
And Katy, finally, why is it so important to have a week dedicated to women's health?
So women, I think, are the last to put themselves first. And so oftentimes children or partners or spouses come first, or work. And so I think it's really important to make sure that we're making it a priority for them.
All right, Katy, thank you so much for your time. We appreciate talking to you this Tuesday.
Thank you so much.
Thank you.
Jack's got your forecast after this. We'll be right back.